invites us, I'm going to hit record
Okay.
because I don't want to forget to do that again. Again, we're there. We've already decided on our descriptor, and you agree on that, correct?
Wait, let me look at it. Let's look at it
I
again.
haven't changed it since the last time.
Okay. Counseling for the control associated with high risk substance use. And that's right. Counseling services may include descriptions of oral behavioral effects. Yeah. Administration routes. This includes ingesting, injecting, inhaling, and vaping. Oh, Sandra Berger's on. Hello, Sandra Berger. Unmute yourself and say hey.
Hello.
Hello, Sandra. How are you?
I'm good. How are you?
Wonderful. We just started it up. Can you see my screen right now as well?
Yes.
Okay. So this was a descriptor that we had worked through and kind of all had decided on previous. So I was just pulling this back up, and then we'll go on to the nomenclature as well after.
Do you want to, what about cocaine? Cocaine's not on here. Should it be?
It's not as...
No, wouldn't
But should we just say it's covered under the other pharmaceuticals and chemicals? It's not one of the big ones that's really as much in the news, correct?
Well, it's certainly not in the news, especially since opioids kind of took over
for it.
Killing people.
And methamphetamine's still pretty prominent.
Depends on where you live, and
that's true. That's true.
So, yeah. Well, and that's kind of why it sort of ebbs and flows.
Right. See, like in my area, to my knowledge, methamphetamine is not a problem at all, and cocaine is much more.
Yeah.
But I don't think, I don't know, then we could start saying, speed, and although that's what cocaine is, but
well, methamphetamine, I can tell you that methamphetamine in northern Wisconsin is still very problematic, and it's huge.
And it is here in the Northwest as well.
Yeah.
Yeah. Yeah, no, I mean, it has to be there, but I don't know if I agree that it might just be good to keep it under other pharmaceuticals.
Okay. Sometimes less is more.
Right.
Okay. Miss Sandra, any other suggestions you may have here? We've kind of worked through this one.
Yeah, no, I like it. This could be kind of nitpicky, but I wonder if changing systemic and behavioral, or only because when you read it, the first time you read it, it says to me, it says counseling service.
Oh. I don't know what I did. There we go.
Okay, there. Counseling services may include descriptions of oral, systemic, and behavioral, but I didn't see that little comma. And so my first thought, and I guess being, a hygienist, I don't know, it was like oral, systemic, and behavioral. So I wonder if we did like oral, behavioral, and systemic effects, if that might lessen the chance of people thinking it's oral systemic. Does that make sense?
Yes. I don't know that.
Yeah, it doesn't change the meaning of the sentence. It's three different adverse effects, or systems that are affected: the oral, the behavioral, and the systemic effects. Yeah, I don't mind that change. So switching behavioral and systemic.
Yeah, or oral and behavioral. Just not having oral, systemic, one right after the other,
Okay. Fair enough.
whichever sounds. Counseling services may include descriptions of, oral, behavioral, and systemic effects associated with high-risk substance use and administration routes. This includes ingesting and inhaling and vaping. So snorting would be what?
Inhaling.
Okay. Just double checking. Yeah, no, I like it.
Okay. Well, I'm going to make that change while we're right at it here. Let's see. Now I got to get rid of this little screen.
There you go.
Okay.
I can't believe vaping still doesn't come up as a word.
I know, it's crazy. So when we move on to the nomenclature, this is what we kind of, Sandra had decided on before amongst those of us had been here. Counseling for the control and prevention of adverse health effects associated with high-risk substance use.
Okay, short and sweet. Yep.
Short, sweet.
It covers a lot of ground.
It does.
Yeah.
It does in one short sentence. And so the rationale, we had noted some of these other ones. What you see in bold is what I added to as of today. And the e-cigarettes or vaping use is being investigated as a causative link with reports of seizures and linked to at least 8 deaths. According to today, the CDC says it's absolutely the cause of 8 deaths and over 530 cases of severe lung disease. The other ones we had gone through as part of the rationale. So, thoughts?
We can cite, I don't, maybe in quotes or something, we can give some statistics to go along with it, and then the citation.
Is that but is that in the rationale, or is that coming to the other sources where you have to cite those on the form, which I'll show you in a couple of slides down?
Yeah, I don't know. You probably know more. You probably looked at that more than I have. So, yeah, it may come at a different time. Obviously, we want to support. We want to show that we're not just, pulling this stuff out of our rumps here. It's coming from reliable sources. And I think I would like to, well, you mentioned it there, the U.S. Surgeon General, but I would even leave maybe the very first statement, say there have been numerous calls to action for dental professionals and anyone in healthcare to educate themselves, educate others, and then begin to help their patients mitigate the effects of high risk use of chemicals and substances. We've done that with tobacco, and now we can't just shake our heads and go tisk tisk. This is terrible. I mean, yeah. Right.
To
educate themselves and others.
Should we say on the dangers of substance use?
High risk substance use. Go back to that statement, because you don't want to say illegal drugs or anything like that. There's,
Substance, absolutely, because it's covered the opioids There's been
Right.
calls to action on opioids. There's been it on the vaping. There's been it on tobacco,
Right.
methamphetamine.
Right.
So it,
Exactly. So high risk, put high risk in front of substance use. There.
Sandra, your thoughts? Does that look good, sound good?
Many calls to action by FDA to educate themselves and others on the dangers of high risk. Yeah, no, I like that.
Okay.
It's what prompted us to ask for a new code.
Mm-hmm.
Exactly. So that's okay. So if we've got there, we've got our, and I'll cite the source as well, like on the opioids and the deaths. So
Okay.
those will be cited in there as well.
Awesome.
This is the form.
Okay.
And then I'll just change the systemic and behavioral on this as well. But this is the form we have to fill out to submit. I did not enter the rationale yet, pending on what we decided today.
Okay.
How the beginning of it looks. We've got a
Mhm.
nomenclature, our descriptor. I'll fill in the rationale. Similar to, this was a previous submission. You can see how the rationale's there as well. And I'll break it down into the sentences like that as well. But I noticed here they don't cite any of the sources. Should we cite the sources in this part? Or just naming it in the other? Because here, number 5 is supporting documentation or literature. This is where we put in the studies, where it comes from, anything else supporting documentation to be considered.
Right. The studies, the calls to action, the articles. I mean, I would, I don't know, like kiss their butt a little bit. You know, cite ADA's position papers on whatever you can find, and you know, any other professional organization that has a position statement, or either a position paper or a policy. If it's a policy, it carries a little bit more. You know, they put money behind it, then they.
Well, and that's what, like we were talking before Sandra came on, about Illinois passing that. So I would love to find out what that is they passed,
Right.
and to be able to cite it here if need be, because our numbers on the amount of deaths and lung disease are going to change between now and when this goes in front of the CMC in March.
Right.
And we'll just go be prepared with the latest numbers. But this is where that is all going to go into place. This is one that Linda sent me that is the study for the vaping of the cannabis and some of this, the excerpts out of that. This is a site we can, or a study we can cite as well.
Mm-hmm. Is there anything here that just kind of jumps out at you as far as like a quote that you could enlarge or, you know, put into a little frame rather than have? I wonder if anybody's.
Some of them are listed like this, but just have the excerpt on them, right. And on previous ones that I compared it to. I mean, where it says the biggest concern lies among adolescents and young adults.
So what I would say that middle sentence, the sentence right in the middle that starts with early research suggests that e-cigarette poses a higher risk for subsequent tobacco use later in youth and adulthood.
Followed by the next sentence: cough, wheezing, bronchitis, long-term use.
Right. And this was written way before the first death was reported, I think.
But I don't understand why the heading is electronic delivery of cannabis and nicotine. It doesn't talk about cannabis at all.
It includes that in there.
I don't see it. I mean, I just read it. I don't see it. It talks
It doesn't
about
say
electronic
cannabis,
nicotine
yeah.
delivery.
You're,
What?
you're looking at an excerpt, and it's
Oh,
not.
okay. All right.
It's not the
The
full
name of
study.
the article is electronic
Mhm.
delivery, and then, right. So that's why.
And there's
Okay.
more of them. Sandra too will include in it. It doesn't have to be this one, but it's just kind of example of it as well.
hmm
There's one on methamphetamine right here too. Just kind of some excerpts from that. It's a stimulant, public health risk in the U.S. worldwide. So it kind of goes off there. We'll pull some more studies too that include, the dangers of death. We'll link the stuff from earlier, the alcohol use as well as the death stuff. We'll cite or make those citations as well. And this is where those numbers are going to come from. Are going to go in there too.
It's good. Looks official.
Those are a few. Those are the call to actions. The U.S. Surgeon General's report, call to action from the CDC, the FDA, American College of Pharmacies, and that's their statements on the opioids.
Mm-hmm.
So there's lots of studies we can come out because we're a little bit broad on the substances we're including. So we can pull a little of everything.
Right.
On that form for that number 5 that had the extra literature, one of those I looked at, that was 2 pages long of studies they provided.
Mm-hmm.
So, and it didn't list the whole study. It had a summary and the source. Basically the title, the summary, and the source. And so it wasn't the whole study listed, but it had study after study after study after study, which I think is something we're going to have to dial in as well.
Yeah.
We can also pull the FDA's stance on it too. This again was more on the vaping end of it. And that's the quote from the acting commissioner.
Mm-hmm.
And Sandra, what's your thought as you're going along? Are you kind of on board with these? Is this what?
Yeah.
Is definitely open to input here.
No, this is good.
Good.
I wish it could still stand like this. Just stand it.
It's amazing how much stuff is changing. And it seems like on this, on some of these, it's changing on a daily basis.
Right.
And it has so many repercussions. It's just like a snowball effect. It's crazy.
Absolutely is. When I was at Under One Roof, it was, I spoke on this subject, and it was a packed house. I mean, I had a friend tell me that they were turning people away at the door after about 10 minutes after I started.
Yeah.
Wow.
And so it's definitely one of those I probably get a couple emails a week on it still.
Mm-hmm.
But I think there's so many unknowns, and that's the problem.
Right.
And then you got the guys who are mixing them in their garage, somewhere in the Midwest, and that got arrested last week, the week before, because whatever they were mixing was making people sick.
Yeah.
Yeah. Well, that's a shame because that's where it's coming from, I think, but it's all getting buried.
I think, but it's so widespread across the U.S.
Oh, yeah.
That's the thing. Our local news, Idaho's not a big state population-wise, and there's like a ridiculous amount of people they were saying are hospitalized to date with severe lung infections or concerns because of it.
Mm-hmm.
And it, I mean,
Yeah, well, I have a friend whose son had a seizure and went into a coma for close to 10 days. His health is 100% fine. The only thing that they can attribute to it is that he vapes.
yeah. Well, and some of those are the nicotine toxicity because, as you know, they
even did all that. They couldn't figure it out.
Huh.
He didn't have nicotine poisoning. He didn't have a heart issue. He just had like an epileptic seizure almost, is what his wife says. And, fortunately came out of it and is, pretty much okay, but they have no idea.
That's scary.
It's really scary. And, and I'm, I do see like this, last slide, I do see the good in it, in the proper ones and, but there's so much more that can happen now. I mean, even New York just changed is thinking of changing their cannabis laws because they don't allow bud. They only allow oil and products.
Okay.
And so the biggest way that people were using was using the vape.
Mm-hmm.
Not even, so you can't smoke pot, medical pot, in New York. It's illegal to smoke it, but you can vape the oils. And now they have a big disclaimer on their medical marijuana program saying, that even though there's not been anything connected, and obviously the medical marijuana distributors are, up to par, they can't give a blanket statement that they're not going to get sick from vaping.
Well, and there is some speculation that the vitamin E oil in it may be a contributing factor because vitamin E is fine to ingest, but when you heat it up and inhale it, they think that may be a contributing
I don't think
factor.
vitamin E is I mean, when I first started talking about vaping, I went to a local guy who makes his own organic juice, and vitamin E oil was not one of the ingredients.
Isn't there glycerin oil?
There's glycerin in it as well.
Yeah, but glycerin and propofol have been used in like frozen foods and stuff for years.
But again, it hasn't been vaporized and inhaled into the lungs.
But that's not one of the. I mean, and I haven't looked into it that much because as much as I'm sure you have, Jamie, but what I have looked in, it's almost always a substance that shouldn't be there. Like, I don't know why vitamin E oil would be in a vaping product.
Well, and it sounds like they're using it with the THC products. And that's kind of the suspension they're using it with, and that's where they're thinking it's coming from.
Right.
And so that's that's obviously the hard part.
Well, and that's because there's no regulation, so they don't know. Yeah.
Well, and some of these things are coming from China. I mean, things are coming from all over the place.
Oh yeah.
So it's really hard to tell.
Like you said, in someone's garage, you don't know.
You don't know. Even at some of the stores too. I mean, who's to say? Even if you have a legit store, who's mixing it and how are they mixing it if they're doing the customs?
Right. I mean, it could be like a mold or something that we find because it's not being stored properly, and
And see, and that's the key. It's just so widely unknown. But Yeah,
area.
it's definitely interesting, and I think the long-term effect, me personally, I think there's going to be some pretty significant long-term effects that come to light. But who knows what we'll find.
Mm-hmm.
But again, we're not necessarily making that judgment per se. We're saying we're giving you a code to educate you on the possible risks.
Right.
So that's what we're shooting for. I had, after I spoke in there, I had somebody come out and say, you know what? They were so offended by the course that I presented. I got mostly good reviews, but she said, you needed to tell everybody it is the worst thing possible and to tell absolutely everybody to quit this and that. And I said, it's so widely unknown. I brought the facts. I brought what we know to date, but that's where it is. And she was older and kind of just, I think, a different mindset about it, specifically. But
It's definitely, the science is emerging. It's not, we
It
don't
is.
know a whole lot yet. We know some things,
Mhm.
and we need to know a whole lot more before people jump to conclusions. But
Exactly. And that's just,
I'd like to,
we don't know.
When I get the chance, I'm going to, I really want to look at the, what's happening in England.
I've actually
Have
got,
you?
yes, because I've got even responses from overseas that have reached out to me. And so
Because,
we've had
in England, Great Britain, it's best practices to, so doctor, dentist is not following best practices if they don't suggest vaping to their smoking patients.
Mhm.
And I just wonder, like, are there as many cases there? And what is the ruling now?
That's interesting. I'll have to reach out a little bit more. I do have a few connections over in Europe and maybe kind of see what their stance is. I mean, even if nothing else, out of our curiosity.
Right.
I have heard from
is it
people
just
from
the
Belgium.
US that's having
Yeah,
it, or I don't know.
there was a really, and totally off the topic, but there was a really interesting one on the manufacture of the juices and the pods and stuff. And it was really, really interesting to see. They were actually over in China and they were going to plants and comparing plants. And, the differences in the way they're doing this. So, you don't know where it comes from.
Right.
So, but I guess I got off on my own little topic here. This is a statement, and I think their statement probably has changed slightly since this was a couple months ago. But I'll compare and then send anything out to. Maybe what we'll do is we'll get stuff and list in the forums. Sandra, I would love it if you have time. I know you're incredibly busy, but you said the stuff in New York and what they're doing. I haven't looked for any literature on that specifically. If you've got it, I would love it. Or if you could find it.
If you go to New York Medical Marijuana Program,
Okay.
and it's the first page right there. It's very easy to access. I don't know if but yeah, I can, let me see if I can send you that. It's just funny because, like, in the United States, in New Jersey, you can only buy the flower, and if you want to make oils or edibles, you have to do it yourself. And New York is completely the opposite. So,
You know, it's amazing. It really flabbergasts me how different each state can be. I mean, I literally live right on the border of Washington. It's all legal in Washington, but you know, Idaho, I can't see it being legal anytime in the near future. It's such a conservative state.
mhm.
But
I'm going to hit reply all, but here is the, I'm sending you the link. And then the frequently asked questions is really answers a lot.
okay.
You can get a lot of information there.
Okay. So again, we've got him if we bring in the dental aspect too, which I think we better have stuff in there related to dental. We've got one on perio disease status, the link there. Oh, come on, computer, cooperate with me. The inflammatory response with the epithelial cells and the fibroblast. We've got that study in there too that links the damaging responses to the chemicals. We've also got the list the Surgeon General reported on, saying you have a role as healthcare providers to educate your public. A link for questions to ask and to talk about with your patients. We can add those if we choose to do so. Linda had reached out and had been contacted with Dr. Perlman at the AAPHD. And they just passed, we don't know as a resolution or what exactly it is in Illinois on the subject. So we're trying to connect with them. We haven't had much luck in connecting with other organizations to see if we can kind of get through it, but we've sent what we had to date to her, and hopefully we'll get some sort of response or sharing. But if nothing else, we're going in prepared for what we have.
Right. I know that Dr. Perlman was very much focused on vaping, e-cigarettes only. And when I sent her what we had, I think she was didn't quite understand that we were including many other substances and routes in our code, our submission. We're asking that when we counsel patients about high-risk substance use, that we don't think there should be a code for each one of the substances or routes of administration. We want to
think less is more.
Well, I mean, it depends on how you look at it.
But I mean with us, rather than having multiple different codes for every route.
Right. That's where, but I know that she's very much focused just on vaping. That's all she wants. And so I'm not sure she may sound a little like she doesn't quite, maybe there, our code submission doesn't have as much emphasis on vaping as the one that she wants to do.
Mm-hmm.
Maybe she'll do a separate one. I'll bet that's the case. I bet she's going to do something and we're going to do something, and then it'll be up for debate and scrutiny. So
sounds good.
See what happens.
Perfect. So Sandra, Linda's been on here every time with me too. I know other people have been kind of hit and miss here and there. Any big suggestions here, or you like what you're seeing so far?
I like what I'm seeing. I think it's important. I think a lot of hygienists will, I anticipate that there'll be a pushback, like what kind of training do I have to do this?
Right.
But I hope that they would think that, hey, I know what I'm doing and I am the right person
Sure.
to
Mhm.
talk about that.
The thing
Absolutely.
is, it's a code. If we have a code that does that, and there's lots of things in the code manual that I could do if I had proper training, but
Mhm.
I don't, and so, it's not something that I would tackle. I would refer, I would advise, I would do lots of things, even though a hygienist might be able to do that. This does seem like it depends on the population you're working with. If you've got a big problem with methamphetamine, for example, or anything in your community, and they go to the dentist, a dental office, and talk to a hygienist, and you say, okay, we need to tackle this. And you're going to spend a fair amount of time on it and follow up and all that. Now you have a code.
And it's tracking.
Right.
It's tracking.
Yep.
And you're tracking it, right?
I think that's kind of the key point is, like you said, not everybody's trained in everything, but with it being so prominent in society and the news, we have to be able to do that when needed. And what I think is hygienists are kind of being forced into the subject because it is so prominent and so many people are doing it that it's coming up.
Right.
Well, and people are like, not in my backyard, and and that's just ridiculous. Because
I agree.
if someone can say that they don't have substance abuse in their family, whether it's Uncle Harry, drinking a 24-pack on a football Sunday, to your child overdosing or something, I think that no one can say that it hasn't touched them, as much as they might think that they want to say that.
And like mental health, it's becoming more in the forefront, and it should be. I mean, it's for so many of them, it's a disease. It's addiction is a disease. And they may not go see a doctor, but they're going to come in because they have a horrible toothache, and maybe that's the opportunity to help somebody get help.
Exactly.
So, well, perfect. What I will do, I will get things put in there into that form, kind of what we were talking about. And if you come up with anything else between now and soon, please send it on, and we can add it in there. Studies, information that's out. Like I said, I'll before I send it off to Patty and for the meeting, we'll make sure we have the most recent numbers on, especially on the vaping, and if anything else comes out before then too.
The way you can handle it, it is going to change probably every week. It's going to change, but I would say as of the date that I'm writing this, these are
that's what I said. So yeah, I noted the date, September 2019. This was the most recent. So
excellent.
Wonderful. Thank you both so much. I appreciate it. Definitely couldn't do it without you.
Thank you for putting all that together.
Yes, I wish I could have been here more, but
you know what? Life happens, and you have grandbabies, and you should enjoy them.
Yeah. And
so, but I definitely appreciate
9 o'clock are just crazy for me.
Oh, I bet. So wonderful. Thank you both so much. And then I will put that together and send it out to the group.
Okay, and I'm sending you links to a couple things. I actually just found an article on CNN. Isn't my favorite source, but it was interesting on the difference between the U.S. and the U.K. in vaping.
Perfect.
So I'll mail that out.
It was like Dateline. No, it was, I don't know. It was the one that also hosts the Today Show from time to time. He's on at 6 o'clock every day, but it was on that station. It wasn't CNN, but that had the story about how they were manufactured too. But it's out there. My husband's learned that he records every one of them that comes on if I'm not home, and he sees it.
Oh, that's
The
funny.
news reports. Oh my gosh.
Yeah.
My daughter told me the other day, she's in 8th grade, that some kid took out a vape pen during class and tried to get away with it in the middle of class. So,
Oh yeah. Well, and you know that they can't punish them for that. It's considered, I don't know, like behavioral. It's not against the law or something. So you can't be expelled for it, at least in my area, or at least what I was researching it when I just did a course. It's just crazy.
yeah, it like here, she told me, and granted, I'm taking her take on it, but they suspended him again for a couple days. This was the 3rd time he's got busted doing it in school. And I mean, we're talking about 13-year-olds.
Yeah.
Yeah.
So, yeah, but we'll see what happens.
Hi.
Well, thank you both. And then
Okay,
I will
you're
get
welcome.
together and an email out. Probably won't be later till this, probably about Friday, but we'll run with it.
Good deal.
Wonderful. Thank
Sounds
you.
great. Thank you.
Have a good night.
All right. Thanks, Jamie.
You too.